How can you know if you did harm to your body after having surgery? I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist, and I provide education and commentary on all sorts of sports and exercise, injuries and injury treatments and injury prevention for athletes and active people, probably much like yourself, so that you can stay healthy and perform your best. You know, as an orthopedic surgeon, I perform hundreds and hundreds of surgeries all year. Mainly shoulder and knee surgeries, but they may be elbow or ankle surgeries. Really, any body part you could potentially hurt in sports and exercise, or maybe at school or at work that's keeping you from playing sports or exercising, I do a lot of those surgeries. And every so often, I'll get a patient in their regular follow-up visits that says, you know, I did something and now that area hurts worse than it has. You know, they may have tried to lift something that they normally wouldn't after shoulder surgery, or they may have stepped wrong, after knee surgery, and now their knee is all swollen, or it's stiffer than it has been. People don't want to be laid up. A lot of times surgeries, I don't put a lot of restrictions on people, but as orthopedic surgeons, sometimes we have to protect whatever the structure it is that we repaired. And so, maybe you didn't want to ask for help and you just tried to pick something up and you feel an unusual pain, or again, something's more swollen than it has been, or stiffer than it has been. How can you know if it's just a normal setback, or did you do real harm to it? And that's what I want to discuss in today's Ask Dr. Geyer video about a specific shoulder surgery, and that's a repair of the rotator cuff tendons. Christian asks, I had rotator cuff surgery. About a week later, I stupidly tried to lift a bicycle with my fingertips. I immediately felt pain in my shoulder, and it throbbed for about 24 hours after that. My doctor says we won't know for 4 to 6 months whether I damaged the repair. What do you look for to assess whether someone has damaged the repair? Well, Christian's question is terrific because, again, that can be a scary feeling to think, I just had major surgery. Did I potentially damage it and have to start all over again? How can you know? Well, the first part of it I think that's important is after any of these surgeries, we do very often protect the shoulder or the knee or whatever the body part to allow the area to heal. The rotator cuff muscles or muscles off the shoulder blade, they form tendons that attach to the ball of the ball and socket joint. So I would go in there and reattach that torn tendon with stitches and anchors, but you have to basically immobilize the shoulder for a few weeks and limit motion, limit strengthening activities to allow your body to basically heal that tissue where you sewed it back together. The stitches and anchors are only going to hold it so long. Your body has to basically turn that repair into the tendon attached to bone, and that takes time. So if you do too much too soon, yes, you can potentially damage the repair. So that's why we set limits and tell you, hey, you got to stay in the sling, or no lifting heavier than maybe a bottle of water or something like that. But maybe you're doing okay, but you try to do something and you feel a sharp pain. Is that a sign of something potentially worrisome? The first part I want to answer, and then I'll come back to that point, is what his doctor said about it's sometimes 4 to 6 months before you really know. And that's because the repair process is a process over time. You're gradually going to get more motion. You're gradually going to get more strength as that tendon repair gets more solid. Even an MRI can't completely tell you whether or not you re-injured it. Yes, the MRI showed you that you tore it in the first place, but the problem is, as that tendon is healing, the MRI may show part of it intact, but some of it not, and you don't know, is that just normal healing, or is that you had a tendon that was healed and then you disrupted the repair? So we like to wait until about 4 to 6 months, because at that point the tendon should be healed and the MRI means a lot more. I think the best way to go about this is to figure out kind of the normal progression and where you are in relation to that progression. So, again, early, you're just going to immobilize the shoulder, limit motion to maybe just some simple things, maybe moving it with your other arm or a broomstick, or the physical therapist moving it with you. Then you're going to work on getting more and more motion back in different directions. Then you may work on strengthening. And what you should see over weeks and months is a progression. It should be slowly getting better and better and better. And what you would look for is, hey, I've been making good progress over weeks and months, and then all of a sudden, now my motion's a lot worse. I'm a lot more swollen. I'm a lot stiffer. I have less motion. Or yes, I'm having a lot more pain. And that can be, 1 or 2 days. We don't typically worry too much. That could just be, that could be a setback. But it's when it's been going on and you're a lot worse now for a week or even 2 weeks. And that can be difficult for you to assess because you're living it every day. You lose a little bit of perspective, honestly. But the doctor and the physical therapist who sort of see you a little bit from a distance, especially the doctor where we may see you only every few weeks, we have a good sense of where you are, maybe at 2 weeks. Now, should you be where you are at 6 weeks? And if you're not there, is that a sign of something bad? So my advice would be, obviously, pay attention to significant decreases in motion, strength, or increases in pain or swelling. But talk to your doctor. Talk to your physical therapist who have been working with you that whole period of time and see what they think. They can do some tests to really get a good sense if you did some real damage. Very often you didn't, but that's why we put some of those restrictions on to improve the chance that you have the best possible outcome. Okay, have you had rotator cuff repair surgery or some other shoulder surgery or maybe knee or elbow or ankle surgery? And did you do something that caused a setback in your recovery? I would love to hear your experiences. Good, bad. I'd love to hear your stories and how surgery and the recovery went for you. So below this video, share your experience. Leave your comments. I'd love to read them, and I know other people going through this problem would love to read those as well. And if you know somebody that's either had a rotator cuff repair surgery or some other knee or shoulder surgery and they're struggling to recover after that surgery, please share this video with that person, and hopefully it can help them have a good sense of, did I do anything bad? Am I progressing the way I should be after surgery? If you like videos like this and you want more information on sports and exercise injuries, injury treatments, and injury prevention, subscribe to my YouTube channel. Click the subscribe button in the upper right corner of this page. You'll get videos on ways to stay healthy and perform your best delivered directly to you. Thank you so much for watching. I hope this video was helpful. Again, I'd love to hear your experience overcoming knee, shoulder, or really any kind of sports and exercise surgery. And I look forward to seeing you right here next time.